Congratulations, you have reached the last chapter of this webinar. After we have given you a lot of information about smokeless tobacco, e-cigarettes, and West Virginia tobacco patterns, what do we want you to do with this information? This section is about helping your patients help themselves in quitting tobacco. You have two facilitators, myself, Donald Reed, and Dr. Peggy Lambert-Fink.
The West Virginia Hospital Association says it's inconsistent to provide health care and at the same time remain silent or inactive about a major health risk. And tobacco cessation is an important component of therapy. Almost 53% of West Virginia adult smokers tried to quit smoking within the last year. 70% of current smokers want to quit smoking. When current tobacco users were advised to quit, 68% made a commitment to quit. While tobacco use assessment is considered a vital sign, we as healthcare providers are missing an important teaching moment. Over 79% of current tobacco users had seen a doctor, dentist, nurse, or other healthcare professional in the last 12 months. More than 56% of current tobacco users had been advised by a healthcare provider to quit smoking or using smokeless tobacco in the past 12 months. 65% of women smokers were advised to quit, while only 50% of men were advised to quit. So how can you best help your patients with tobacco cessation?
This is one of the most important slides. This is the 3-minute intervention that we want you to use with your patients that may change their life or save their life. We are asking you to ask, advise, and refer. Ask about tobacco use. Advise the tobacco user to quit. Refer the patient to the appropriate resources. Ask about tobacco use at every visit. An example would be, do you currently smoke or use any other form of tobacco? Advise tobacco users to quit. Clear, precise, direct instruction. An example would be, quitting tobacco is one of the best things you can do for your health. I strongly encourage you to quit. Are you interested in quitting? Oftentimes, healthcare professionals underestimate the value of their advice. Be clear, precise, and direct to your patients. Be aware that it takes an average of 4 to 10 quit attempts for someone to be successful in quitting tobacco. Counsel your patients for success. If your patient is not ready to quit, strongly encourage them to consider quitting by personalizing your message. Let them know that you're there to help them when they're ready for help. The last step is to refer your patients to resources. These should be community resources to help them quit. If you're unsure of the resources in your community, contact the West Virginia Division of Tobacco Prevention or always refer your clients to the West Virginia Tobacco Quit Line. Again, ask your patient about tobacco use. Advise them to quit. And refer them to the West Virginia Tobacco Quit Line. In addition to the West Virginia Tobacco Quit Line, we would encourage you to provide printed education materials, referral to a local class or program, one-on-one counseling with their provider, and discuss pharmacotherapy options.
As you go through the 3 steps, ask, advise, and refer, remember these human behavior tips. People believe what they hear themselves say.
People resist what is forced upon them. They must be an active participant in the process.
People support that which they have helped create. They need to be part of creating the plan to quit.
People like to be heard and validated. It's very important that you listen to the concerns and even fears of your clients about a quit attempt.
People are empowered when they are built up and disempowered when they're put to shame.
The West Virginia Tobacco Quit Line, 1-800-QUIT-NOW, is your most valuable resource. It will provide pharmacotherapy options as well as a personalized quit plan. For smokeless tobacco users, there is a special protocol at the West Virginia Tobacco Quit Line. For providers, we wanted just to provide you a sample of that protocol. Again, we are asking you to do 3 things with your patients. Ask about tobacco use. Advise the tobacco user to quit. And then refer the patient to the appropriate resource.
We need to keep in mind the power of intervention. If we, as healthcare providers, advise 90% of our patients to quit and offer them medication or other assistance, we can extend 42,000 lives each year. 42,000 lives, that's grandmothers, grandfathers, fathers, and mothers, real people. We're now offering this to only about 28% of our patients. According to the West Virginia Hospital Association, this slide indicates that as time spent with the patient by the provider, as shown on the left, increases, so does the increase in quit rate. With the moderate interventions such as ask, advise, and refer, spending 2 to 5 minutes with the patient has a 4-fold increase in quit rate. That's more lives saved with a little more time spent with your patients.
Earlier in this webinar, we heard from Kathy Danbury from the West Virginia Division of Tobacco Prevention. And now we're going to bring her back to share with us a personal success story. And we'll bring in, by phone, the other person who was instrumental in her success story. And that's Cindy Kittle of the Healthcare Education Foundation of West Virginia. Kathy, will you and Cindy tell us this story?
Certainly, Donald. Yes, I can tell you the story. I'm a former smoker. I smoked for 15 years. In 1990, I started working for the state, and that was about the same time that the state capitol went tobacco-free. I enrolled in a program that Cindy Kittle was facilitating. On November 10th, 1990, I laid down my cigarettes and haven't picked them up since. 26 years later, Cindy and I are still friends. On November 10th every year, as close as I can get to 1:30, I call Cindy to thank her. Cindy saved and changed my life.
I can't believe it's 26 years, honestly. But to be truthful, the highlight of my career, honestly, has been working with people like Kathy, and I love getting the phone call every year. It's very renewing and energizing to me. Her success story is a success for me as well, and it's often frustrating when you work with tobacco users. It's easy to get burned out, and when that happens to me, I remember this relationship with Kathy, and when I see what she's done since she quit herself, she's helped promote tobacco cessation and has helped thousands of people get access to cessation services and quit using tobacco. So what I'd like to say to each of you as we conclude this webinar, as healthcare providers, I hope you take the challenge and ask yourself, whose life can you change?
We will reinvent West Virginia's future by strengthening 3 critical pillars: education, healthcare, and broad-based prosperity. Prosperity will remain elusive if our workforce lacks education and our citizens are suffering from disease and despair. Young people who are sick or whose families languish in poverty will struggle to fulfill their educational potential. A lack of knowledge or financial resources will keep some of our citizens mired in ill health. Education, health care, and prosperity. They are inseparable, they are essential, and they are what West Virginia University is uniquely empowered to generate.
Through this presentation, we hope you have gained education about the different forms of tobacco that are commonly used in West Virginia today, and that you, as a healthcare professional, will be willing to embrace the cessation intervention steps we have shared with you to change a life, to prevent someone from suffering disease, and to rescue someone from the despair of addiction. The last step in the webinar process is the post-test. Remember that you must score at least an 80 on this test to receive the CEU credit.